Greetings and a great pleasure to be with you, even if only virtual. I'm sorry to miss this critical meeting. Whenever we talk about air quality, this is my passion and to what I have been dedicated many years, my engagement, my passion, and hopefully where we have been able all together to have some impact. Over the last years, particularly the last 2 decades, we have been using the scientific evidence to develop policy recommendations. We have been raising awareness. We have been doing a lot of mobilization campaigns. We have developed the air quality guidelines. We have mobilized governments, making sure they adopted resolutions at the World Health Assembly. Recently, last year, even a plan of action. And now it's time to ask ourselves how we can scale up, how we can grow a little bit more, and particularly how we can grow at the level of the magnitude of the problem that we are addressing. We have put in place interventions that have proved to be very effective. We have approved resolutions that were signed by ministers of health of 194 countries around the world. We have convinced them that this issue of air quality or lack of air quality could be as well a way to connect the two agendas of climate change and air pollution, and both interventions that were useful for addressing and tackling the causes of climate change were useful as well to address the causes of air pollution. We have mobilized local leaders. I think this was probably one of the most successful ones on making them understand that if you want good citizens at the urban level, if you want your citizens to vote you, the interventions that you put in place to reduce the air pollution in your city and therefore reducing the diseases and mortality associated with that, a package of interventions was available, and we can even quantify for them the positive health outcomes that can be obtained. We have worked together, the scientific community, academics, civil society, people doing advocacy. We have mobilized youth. We have been doing, I think, a very important set of activities to put on the agenda, on the political agenda, the issue of air pollution. Now, clearly, we don't have enough action, the action we needed, as I say, for the magnitude of the problem we are facing. But nobody can say, I didn't know. There are no excuses. Nobody can say that a mayor cannot say, I didn't check the quality of the air on my city, and therefore I never thought about what air quality could represent for my citizens. Nobody can escape the debate. There are, in the European Union, there are even now very strict rules that standards that will be put in place and hopefully will benefit the health of the people. But again, it's not enough, and we need to scale up. We need to grow in an exponential way the efforts we are putting in place to tackle air pollution. And maybe one of the key pieces that we need to now put in place and collaborate all of us, and going through the painful situation that we had years ago when we started to develop the guidelines on air quality guidelines in WHO, maybe, and what we are missing, the piece we are missing is, what about indoor air pollution? How can we raise more awareness about the need for standards, for recommendations, for guidelines on about the quality indoors where we spend most of our time. The awareness raising is certainly one of the big pieces. Scientific evidence is there. Now we need to collate all of those pieces, make sure that we create a network as we have, and we keep pushing for this important challenge, and collaborating all of us and through all of these partnership meetings like the ones, Congress like the ones we are attending today, will give us the importance and how to elevate this issue at the political agenda the way we need. Probably at the urban level, awareness is there, and we have our partners, the mayors or the local municipal authorities, that, as I say, for them there are no excuses. They are confronted to the situation and they cannot argue that they didn't know or they didn't have interventions. Indoor air pollution is another issue. We need to accelerate access to clean sources of energy for those countries where indoor air pollution is associated with the use of very old fuels and very polluting ones, but maybe having a package of interventions and guidelines and recommendations and standards will facilitate all of this effort. So I'm sure that you will have very good answers to all of those questions. The science is there. We know that the big public health challenge that this represents, and therefore, for us, there are no excuses either. So good luck, and hopefully we will keep pushing for this important agenda. Thank you very much.